Hey Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 100 Practice NCLEX questions. Without the way, let's get started.
A client is afraid of receiving vitamin B12 injections because of potential toxic reactions. Which is the nurse's best response to relieve these fears? 1. Vitamin B12 will cause ringing in the ears before a toxic level is reached. 2. Vitamin B12 may cause a very mild rash initially. 3. Vitamin B12 causes mild nausea, but nothing toxic. 4. Vitamin B12 is generally free of toxicity because it is water-soluble. The correct answer is 4. Vitamin B12 is a water-soluble vitamin. When water-soluble vitamins are taken in excess of the body's needs, they are filtered through the kidneys and excreted. Vitamin B12 is considered to be non-toxic. Adverse reactions that have occurred are believed to be related to impurities or to preservative in B12 preparations. Ringing in the ears, rash, and nausea are not considered to be related to vitamin B12 administration.
A nurse says, "If you do not let me do this dressing change, I will not let you eat dinner with the other clients in the dining room." Which legal term is related to this statement? 1. Battery. 2. Assault. 3. Negligence. 4. Malpractice. The correct answer is 2. Assault. The statement in option 2 is an unjust threat. Assault is the threat to harm another person without cause. The statement in option 1 is not an example of battery. Battery is the actual willful touching of another person that may or may not cause harm. The statement in option 3 is not an example of negligence. Negligence occurs when harm or injury is caused by an act of either commission or omission. The statement in option 4 is not an example of malpractice. Malpractice is negligence by a professional person as compared with the actions of another professional person in a similar circumstance when a contract exists between the client and nurse. Which is the primary purpose of the American Nurses Association Standards of Clinical Nursing Practice? 1. Define the philosophy of nursing practice. 2. Establish criteria for quality nursing practice. 3. Identify the legal definition of nursing practice. 4. Determine educational standards for nursing practice. The correct answer is 2. Establish criteria for quality nursing practice. The American Nurses Association Standards of Clinical Nursing Practice describe the nature and scope of nursing practice and the responsibilities for which nurses are accountable. A philosophy incorporates the values and beliefs about the phenomena of concern to a discipline. The American Nurses Association Standards of Clinical Nursing Practice reflect, not define, a philosophy of nursing. Each nurse and nursing organization should define its own philosophy of nursing. The laws of each state define the practice of nursing within the state. Educational standards are established by accrediting bodies, such as the National League for Nursing Accrediting Commission, the Commission on Collegiate Nursing Education, and state education departments.
As an initial step in treating a client with angina, the physician prescribes nitroglycerin tablets, 0.3 milligrams given sublingually. This drug's principal effects are produced by 1. Antispasmodic effects on the pericardium. 2. Causing an increased myocardial oxygen demand. 3. Vasodilation of peripheral vasculature. 4. Improved conductivity in the myocardium. The correct answer is 3. Vasodilation of peripheral vasculature. Nitroglycerin produces peripheral vasodilation, which reduces myocardial oxygen consumption and demand. Vasodilation in coronary arteries and collateral vessels may also increase blood flow to the ischemic areas of the heart. Nitroglycerin decreases myocardial oxygen demand. Nitroglycerin does not have an effect on pericardial spasticity or conductivity in the myocardium.
A patient with chronic hepatitis C has been taking a daily dose of the antiviral medication Ledipasvir. So, Fospivir for the past month. Which information is the most important for the nurse to communicate to the healthcare provider? 1. The patient reports mild headaches that come and go. 2. The patient complains of feeling chronically tired. 3. The patient has missed a period and is having unprotected sex. 4. The patient reports nausea and occasional diarrhea. The correct answer is 3. The patient has missed a period and is having unprotected sex. Rationale. During pregnancy, this medication is prescribed with caution and only if clearly needed. The healthcare provider must discuss the risk versus benefits with the patient and then decide to continue or discontinue the medication. Headache, fatigue, nausea, and diarrhea are common adverse effects of ledapaspir, sulfosbuvir, and should be reported if persistent or recurrent.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is developing a discharge teaching plan for the client diagnosed with congestive heart failure. Which interventions should be included in the plan? Select all that apply. 1. Notify healthcare provider of a weight gain of more than 1 pound in a week. 2. Teach client how to count the radial pulse when taking digoxin, a cardiac glycoside. 3. Instruct client to remove the salt shaker from the dinner table. 4. Encourage client to monitor urine output for change in color to become dark. 5. Discuss the importance of taking the loop diuretic furosemide at bedtime. The correct answers are 2. Teach client how to count the radial pulse when taking digoxin, a cardiac glycoside, and 3. Instruct client to remove the salt shaker from the dinner table. The client should not take digoxin if the radial pulse is less than 60. The client should be on a low-sodium diet to prevent water retention. The client should notify the HCP of weight gain of more than 2 or 3 pounds in one day. The color of the urine should not change to a dark color. If anything, it might become lighter, and the amount will increase with diuretics. Instruct the client to take the diuretic in the morning to prevent nocturia.
The 55-year-old African-American male client presents to the emergency department with blurred vision, slurred speech, and left-sided weakness. The client has a history of hypertension and benign prostatic hypertrophy. Which statement regarding the client's medications should the nurse ask at this time? 1. Have you been taking over the counter herbs to treat the BPH? 2. Do you take an aspirin every day to prevent heart attacks and strokes? 3. Do you eat green, leafy vegetables frequently? 4. Have you been taking medications routinely to control the hypertension? The correct answer is 4. Have you been taking medications routinely to control the hypertension? Rationale. Many medications for hypertension have the adverse effect of causing erectile dysfunction, which many men are hesitant to discuss with their HCP, and a man may simply stop taking the medication to avoid the side effect. The nurse should assess how the client has been controlling his hypertension and ask specifically about erectile dysfunction related to hypertensive medication. Hypertension is a risk factor for developing other cardiovascular diseases, including stroke. This client has 2 risk factors for developing a stroke: hypertension and his racial background. The nurse should ask all clients about taking OTC preparations when being admitted, but this question would have no bearing on the clients presenting symptoms of a stroke. The client has symptoms of a stroke. Whether he was taking an aspirin to prevent a potential problem is irrelevant. The client has a problem at this time. Green, leafy vegetables are high in vitamin K, the antidote for Coumadin. The client has no reason to be taking an anticoagulant at this time.
The adult client recently has been diagnosed with asthma. Which medication is recommended to treat this problem? 1. Omeprazole daily. 2. Amoxicillin twice daily. 3. Loratadine daily. 4. Prednisone daily. The correct answer is 1. Omeprazole daily. Omeprazole is a PPI. Up to 90% of adult-onset asthma is the result of gastroesophageal reflux disease. Treating gastric reflux will treat asthma. Amoxicillin is a penicillin-derived antibiotic. The client is diagnosed with asthma, not an infection. There is no reason to administer an antibiotic. Loratadine is an antihistamine. Antihistamines such as Claritin are used to treat allergic reactions to pollens, dust, or other irritating substances. They are not effective against asthma. Prednisone is a glucocorticoid. Glucocorticoids are prescribed daily for clients with chronic lung diseases, such as emphysema or chronic bronchitis. A client with asthma would not be prescribed a daily steroid.
The nurse is caring for a client diagnosed with a hemorrhagic stroke. Which medication should the nurse question administering? 1. Clopidogrel, 2. Mannitol, 3. Nifedipine, 4. Dexamethasone. The correct answer is 1. Clopidogrel. Rationale: the client has experienced a bleed into the cranium. Clopidogrel, an antiplatelet, interferes with the client's clotting ability. This medication should be held and discussed with the HCP. There is no reason to question giving a medication that will decrease intracranial pressure. Mannitol is the diuretic of choice for this client. It is an osmotic diuretic, which has the best effect on the cranial tissues. Nifedipine is a calcium channel blocker that will decrease the client's blood pressure, which is elevated in clients with increased intracranial pressure. Dexamethasone, a glucocorticoid, will decrease edema, resulting in decreased intracranial pressure.
The nurse is teaching the client with type 1 diabetes how to use an insulin pen injector. Which information should the nurse discuss with the client? 1. Instruct the client to dial in the number of insulin units needed to inject. 2. Demonstrate the proper way to draw up the insulin in an insulin syringe. 3. Discuss that the insulin pen injector must be used in the abdominal area only. 4. Explain that the traditional insulin syringe is less painful than the injector pen. The correct answer is 1. Instruct the client to dial in the number of insulin units needed to inject. The insulin pen injector resembles a fountain pen. It contains a disposable needle and insulin-filled cartridge. When the client operates the insulin pen, the correct dose is obtained by turning the dial to the number of insulin units needed. The insulin pen injector does not require drawing up insulin in a syringe. The insulin pen injector can be used in any subcutaneous site where traditional insulin can be injected. Most clients state that there is less injection pain associated with the insulin pen than there is with the traditional insulin syringe. The client newly diagnosed with type 1 diabetes asks the nurse, "Why should I get an external portable insulin pump?" Which statement is the nurse's best response? 1. It will cause you to have fewer hypoglycemic reactions, and it will control blood glucose levels better. 2. Insulin pumps provide an automatic memory of the date and time of the last 24 boluses. 3. The pump injects intermediate-acting insulin automatically into the vein to maintain a normal blood glucose level. 4. The portable pump is the easiest way to administer insulin to someone with type 1 diabetes and is highly recommended. The correct answer is 1. It will cause you to have fewer hypoglycemic reactions, and it will control blood glucose levels better. A portable insulin pump is a battery-operated device that uses rapid-acting insulin, Lispro, Humalog, or Novolog. It delivers continuous release of a small amount of insulin and bolus doses with meals. This provides fewer hypoglycemic reactions and better blood glucose levels. The pumps do provide a memory of boluses, but that is not the nurse's best response to explain why a client should get an external portable insulin pump. External portable insulin pumps are only used to deliver rapid-acting insulin subcutaneously. Intermediate and long-acting insulins are not used with an external portable insulin pump because of unpredictable control of blood glucose. The insulin pump is not recommended as the initial way to administer insulin because the success of the insulin pump depends on the client's knowledge and compliance. Initially, most clients start injecting insulin with a syringe and then graduate to the pumps. Which statement best describes the pharmacodynamics of insulin? 1. Insulin causes the pancreas to secrete glucose into the bloodstream. 2. Insulin is metabolized by the liver and muscle and excreted in the urine. 3. Insulin is needed to maintain colloidal osmotic pressure in the bloodstream. 4. Insulin lowers blood glucose by promoting the use of glucose in the body cells. The correct answer is 4. Insulin lowers blood glucose by promoting use of glucose in the body cells. The statement in option 4 explains the pharmacodynamics, which is the drug's mechanism of action or way that insulin is utilized by the body. Over time, elevated glucose levels in the bloodstream can cause long-term complications, including nephropathy, retinopathy, and neuropathy. Insulin lowers blood glucose by promoting the use of glucose in body cells. The pancreas does not secrete glucose. It secretes insulin, which is the key that opens the door to allow glucose to enter the body cells. Glucose enters the body through the gastrointestinal system. The statement in option 2 explains the pharmacokinetics of insulin and how the body metabolizes it and excretes it in urine. Pharmacokinetics is the process of drug movement to achieve drug interaction. Insulin does not maintain colloidal osmotic pressure. Albumin, a product of protein, maintains colloidal osmotic pressure.
The nurse is reviewing medication lists for patients who are being treated for peptic ulcer disease. The nurse is most likely to question the use of which medication? 1. Ibuprofen. 2. Omeprazole. 3. Amoxicillin. 4. Clarithromycin. The correct answer is 1. Ibuprofen. Rationale. Ibuprofen is a non-steroidal anti-inflammatory drug, and NSAIDs are thought to be one of the aggravating factors of peptic ulcer disease. Omeprazole, amoxicillin, and clarithromycin are used as a triple combination therapy for the treatment of peptic ulcer disease. Which question will the nurse ask the student nurse who is assigned to do an enteral feeding for a patient with a small bore feeding tube? 1. Have you evaluated the nutritional status of the patient? 2. Is the patient tolerating the supine position after feedings? 3. Have you had any problems checking the residual? 4. Is the patient developing any problems related to the feedings? The correct answer is 3. Have you had any problems checking the residual? Rationale. A disadvantage of small bore feeding tubes is that they are prone to clogging, and checking for residuals can be difficult. If the tube gets clogged, it may have to be removed and reinserted. Placing the patient in a supine position is incorrect. The head of the bed needs to be elevated 30 degrees to 45 degrees during feedings and for 30 to 60 minutes after the feeding to reduce the risk of aspiration.
The client who experiences angina has been told to follow a low cholesterol diet. Which of the following meals would be best? 1. Hamburger, salad, and milkshake. 2. Baked liver, green beans, and coffee. 3. Spaghetti with tomato sauce, salad, and coffee. 4. Fried chicken, green beans, and skim milk. The correct answer is 3. Spaghetti with tomato sauce, salad, and coffee. Rationale. Pasta, tomato sauce, salad, and coffee would be the best selection for the client following a low cholesterol diet. Hamburgers, milkshakes, liver, and fried foods tend to be high in cholesterol.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is taking an initial history for a patient seeking surgical treatment for obesity. Which findings should be called to the attention of the surgeon? 1. Obesity for approximately 5 years. 2. History of counseling for body dysmorphic disorder. 3. Failure to reduce weight with other forms of therapy. 4. Body weight 100% above the ideal for age, gender, and height. The correct answer is 2. History of counseling for body dysmorphic disorder. Rationale. Body dysmorphic disorder is a preoccupation with an imagined physical defect. Corrective surgery can exacerbate this disorder when the patient continues to feel dissatisfied with the results. The other findings are criterion indicators for this treatment.
A nurse is assessing a child in relation to the stages of Jean Piaget's theory of cognitive development. Which behavior indicates that the child has reached the formal operation stage of cognitive development according to Piaget? 1. Utilizes deductive reasoning when examining alternatives. 2. Uses logical thought to organize collected information. 3. Investigates objects by placing them in the mouth. 4. Employs language to communicate with others. The correct answer is 1. Utilizes deductive reasoning when examining alternatives. Rationale. Utilizing deductive reasoning to examine alternatives reflects the formal operation stage of cognitive development. These individuals use symbols related to abstract concepts and are capable of hypothetical and deductive reasoning.
The client is having status epilepticus and is prescribed IV diazepam. The client has an IV of D5W 75 milliliters per hour in the right arm and a saline lock in the left arm. Which intervention should the nurse implement? 1. Dilute the diazepam and administer over 5 minutes via the existing IV. 2. Do not dilute the medication and administer at the port closest to the client. 3. Question the order because diazepam cannot be administered with D5W. 4. Inject 3 milliliters of normal saline in the saline lock and administer diazepam undiluted. The correct answer is for inject 3 milliliters of normal saline in the saline lock and administer diazepam undiluted. Rationale: the nurse should administer the diazepam, a benzodiazepine, undiluted through the saline lock. Diazepam is oil-based and should not be diluted. It should not be administered in an existing IV line if another option is available. The nurse does not need to question the order because there is an existing saline lock.
A nursing student is performing a colostomy irrigation. When would the nurse intervene? 1. Student hangs the prepared irrigation container on the bed rail. 2. The student puts 500 to 1,000 milliliters of lukewarm water in the container. 3. Student cleans, rinses, and dries the skin and applies a new drainage pouch. 4. The student encourages a patient to walk for 30 to 45 minutes for secondary evacuation. The correct answer is 1. Student hangs a prepared irrigation container on the bed rail. Rationale: the nurse will remind the student that the container has to be hung at shoulder level. If the container is too low, the flow will be sluggish. If the container is below the entry site, the solution will flow retrograde. If the container is too high, the solution will flow too quickly and cause cramping. The other actions are correct.
The nurse on the telemetry unit has just received the AM shift report. Which client should the nurse assess first? 1. The client diagnosed with myocardial infarction who has an audible S3 heart sound. 2. The client diagnosed with congestive heart failure who has 4+ sacral pitting edema. 3. The client diagnosed with pneumonia who has a pulse oximeter reading of 94%. 4. The client with chronic renal failure who has an elevated creatinine level. The correct answer is 1. The client diagnosed with myocardial infarction who has an audible S3 heart sound. An S3 heart sound indicates left ventricular failure, and the nurse must assess this client first because it is an emergency situation. The nurse would expect a client with CHF to have sacral edema of 4+. The client with an S3 would be in a more life-threatening situation. A pulse oximeter reading of greater than 93% is considered normal. An elevated creatinine level is expected in a client diagnosed with chronic renal failure.
The nurse is providing postoperative care for a patient who underwent laparoscopic cholecystectomy. What should be reported immediately to the healthcare provider? 1. The patient cannot void 5 hours postoperatively. 2. The patient reports shoulder pain. 3. The patient reports right upper quadrant pain. 4. Output does not equal input for the first few hours. The correct answer is 3. The patient reports right upper quadrant pain. Rationale: right upper quadrant pain is a sign of hemorrhage or bile leakage. The ability to void should return within 6 hours postoperatively. Right shoulder pain is related to unabsorbed carbon dioxide and will be resolved by placing the patient in a Sims position. For the first several hours after surgery, output is not expected to equal input.
The client diagnosed with rule-out myocardial infarction is experiencing chest pain while walking to the bathroom. Which action should the nurse implement first? 1. Administer sublingual nitroglycerin. 2. Obtain a stat electrocardiogram. 3. Have the client sit down immediately. 4. Assess the client's vital signs. The correct answer is 3. Have the client sit down immediately. Stopping all activity will decrease the need of the myocardium for oxygen and may help decrease the chest pain. The nurse must assume the chest pain is secondary to decreased oxygen to the myocardium and administer a sublingual nitroglycerin tablet, which is a coronary vasodilator, but this is not the first action. An ECG should be ordered, but it is not the first intervention. Assessment is often the first nursing intervention, but when the client has chest pain and a possible MI, the nurse must first take care of the client. Taking vital signs would not help relieve chest pain. Whenever you want to select an assessment intervention, be sure to think about whether that intervention will help the client, especially if the client is experiencing pain. Do not automatically select the answer option that is assessment. The nurse administered 12 units of regular insulin to the patient with type 1 diabetes at 0700 hour. Which meal prevents the client from experiencing hypoglycemia? 1. Breakfast. 2. Lunch. 3. Supper. 4. Nighttime snack. The correct answer is 1. Breakfast. Regular insulin peaks in 2 to 4 hours. Therefore, the breakfast meal would prevent the client from developing hypoglycemia. Lunch would cover an 0700-hour dose of insulin isophane, an intermediate-acting insulin. Supper would cover a 1600-hour dose of regular insulin, a short-acting insulin. The nighttime snack would cover a 1600-hour dose of insulin isophane, an intermediate-acting insulin. Which assessment data best indicates the client with type 1 diabetes is adhering to the medical treatment regimen? 1. The client's fasting blood glucose is 100 milligrams per deciliter. 2. The client's urine specimen has no ketones. 3. The client's glycosylated hemoglobin is 5.8%. 4. The client's glucometer reading is 120 milligrams per deciliter. The correct answer is 3. The client's glycosylated hemoglobin is 5.8%. A glycosylated hemoglobin gives the average of the blood glucose level over the past 3 months and indicates adherence to the medical treatment regimen. A glycosylated hemoglobin level of 5.8% is close to normal and indicates that the client is adhering to the treatment regimen. The fasting blood glucose level is obtained after the client is NPO for 8 hours. This blood result does not indicate adherence to the treatment regimen. If the client has no ketones in the urine, it indicates that the body is not breaking down fat for energy, but it does not indicate adherence to the treatment regimen. A glucometer reading of 120 milligrams per deciliter indicates a normal blood glucose level, but it is a one-time reading and does not indicate adherence to the medical treatment regimen. The nurse is teaching a class on arterial essential hypertension. Which modifiable risk factors would the nurse include when preparing this presentation? 1. Include information on retinopathy and nephropathy. 2. Discuss sedentary lifestyle and smoking cessation. 3. Include discussions on family history and gender. 4. Provide information on a low-fiber and high-salt diet. The correct answer is 2. Discuss sedentary lifestyle and smoking cessation. Remember to look at the adjectives. The stem of the question is asking about modifiable risk factors. A sedentary lifestyle is discouraged in clients with hypertension. Daily isotonic exercises are recommended. Smoking increases the atherosclerotic process in vessels, causes vasoconstriction of vessels, and adheres to hemoglobin, decreasing oxygen levels. Retinopathy and nephropathy are complications of uncontrolled hypertension, not modifiable risk factors. Family history and gender are non-modifiable risk factors. The question is asking for information on modifiable risk factors. A low-salt diet is recommended because increased salt intake causes water retention, which increases the workload of the heart. A high-fiber diet is recommended because it helps decrease cholesterol levels.
The nurse is providing care for a patient with a connective tissue disorder exacerbation for whom the healthcare provider has prescribed an IV dose of methylprednisolone 20 milligrams in 50 milliliters normal saline to be infused over 30 minutes. At what rate will the nurse set the IV infusion pump to administer this drug correctly? The correct answer is 100 milliliters per hour. Rationale. The formula is volume in ml multiplied by 60 divided by time in minutes. You multiply 50 times 60 and divide by 30 minutes. The end result is 100.
A mother asks the nurse to tell her about the responsiveness of neonates at birth. Which of the following answers is appropriate? Select all that apply. 1. Babies have a poorly developed sense of smell until they are 2 months old. 2. Babies respond to all forms of taste well, but they prefer to eat sweet things like breast milk. 3. Babies are especially sensitive to being touched and cuddled. 4. Babies are nearsighted with blurry vision until they are about 3 months of age. 5. Babies respond to many sounds, especially to the high-pitched tone of the female voice. The correct answers are 2. Babies respond to all forms of taste well, but they prefer to eat sweet things like breast milk. 3. Babies are especially sensitive to being touched and cuddled. And 5. Babies respond to many sounds, especially to the high-pitched tone of the female voice. Babies respond to all forms of taste. They prefer sweet things. Babies' sense of touch is considered to be the most well-developed sense. Babies hear quite well once the amniotic fluid is absorbed from the ear canal. All newborns' hearing is tested prior to discharge from the newborn nursery. If a baby is found to be hearing impaired, the baby should receive early intervention. All of the baby's senses are well developed at birth. Babies see quite well at 8 to 12 inches. They prefer to look at the human face. 4 newborns are in the neonatal nursery, none of whom is crying or in distress. Which of the babies should the nurse report to the neonatologist? 1. 16-hour-old baby who has yet to pass meconium. 2. 16-hour-old baby whose blood glucose is 50 milligrams per deciliter. 3. 2-day-old baby who is breathing irregularly at 70 breaths per minute. 4. 2-day-old baby who is excreting a milky discharge from both nipples. The correct answer is 3. 2-day-old baby who is breathing irregularly at 70 breaths per minute. Normal neonatal breathing is 30 to 60 breaths per minute. This baby is tachypneic. Meconium should pass within 24 hours of delivery. This baby's glucose level is within normal limits. A milky discharge, which is milk, is normal. It results from the drop in maternal hormones in the neonatal system following delivery.
The nurse is discussing medications with a client with hypertension who has a prescription for furosemide daily. The client needs further education when the client states which of the following? 1. I know I should not drive after taking my Lasix. 2. I should be careful not to stand up too quickly when taking Lasix. 3. I should take the Lasix in the morning instead of before bed. 4. I need to be sure to also take the potassium supplement that the doctor prescribed along with my Lasix. The correct answer is 1. Furosemide is a diuretic often prescribed for clients with hypertension or heart failure. The drug should not affect a client's ability to drive safely. Lasix may cause orthostatic hypotension, and clients should be instructed to be careful when changing from supine to sitting to standing position. Diuretics should be taken in the morning if possible to prevent sleep disturbance due to the need to get up to void. Lasix is a loop diuretic that is not potassium sparing. Clients should take potassium supplements as prescribed and have their serum potassium levels checked at prescribed intervals.
The nurse is preparing to administer medications in a pulmonary unit. Which medication should the nurse administer first? 1. Prednisone for a client diagnosed with chronic bronchitis. 2. Oxygen via nasal cannula at 2 liters per minute for a client diagnosed with pneumonia. 3. Lactic acidophilus to a client receiving IVPB antibiotics. 4. Cephalexin to a client being discharged. The correct answer is 2. Oxygen via nasal cannula at 2 liters per minute for a client diagnosed with pneumonia. Oxygen is considered a medication and should be a priority whenever it is ordered. A client diagnosed with pneumonia will have some amount of respiratory compromise, and the ordered 2 liters per minute indicates a client with a chronic lung disease. This is the priority medication. Prednisone is a glucocorticoid steroid. This is an oral preparation and one that can be given daily. This is not the first medication to be administered. Lactic acidophilus is a biologic replacement and is administered to replace the good bacteria in the body destroyed by the antibiotic, but it does not need to be administered first. Cephalexin is an oral antibiotic, but this client is being discharged, indicating the client's condition has improved. This client could wait until the oxygen is initiated. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 4-month-old has had vomiting and diarrhea for 24 hours. The infant is fussy, and the anterior fontanelle is sunken. The nurse notes the infant does not produce tears when crying. Which task will help confirm the diagnosis of dehydration? 1. Urinalysis obtained by bagged specimen. 2. Urinalysis obtained by sterile catheterization. 3. Analysis of serum electrolytes. 4. Analysis of cerebrospinal fluid. The correct answer is 3. Analysis of serum electrolytes. The analysis of serum electrolytes offers the most information and assists with the diagnosis of dehydration. The information obtained from a urinalysis of an infant is not as helpful as serum electrolytes. The infant has limited ability to concentrate urine, so the specific gravity is not usually affected. A urinalysis does not need to be obtained by catheterization. Although critical in diagnosing meningitis, a lumbar puncture and analysis of cerebrospinal fluid are not done to confirm dehydration. Infants have limited ability to concentrate urine, so answers 1 and 2 can be eliminated immediately.
The client has had hypertension for 20 years. The nurse should assess the client for 1. Renal insufficiency and failure. 2. Valvular heart disease. 3. Endocarditis. 4. Peptic ulcer disease. The correct answer is 1. Renal disease, including renal insufficiency and failure, is a complication of hypertension. Effective treatment of hypertension assists in preventing this complication. Valvular heart disease, endocarditis, and peptic ulcer disease are not complications of hypertension.
The charge nurse is doing shift assignments for the medical floor. Which client should be assigned to the most experienced nurse? 1. The client diagnosed with congestive heart failure who is being discharged in the morning. 2. The client who is having frequent incontinent liquid bowel movements and vomiting. 3. The client with an apical pulse rate of 116, a respiratory rate of 26, and a blood pressure of 94/62. 4. The client who is complaining of chest pain with inspiration and a non-productive cough. The correct answer is 3. The client with an apical pulse rate of 116, a respiratory rate of 26, and a blood pressure of 94/62. The client in option 3 is exhibiting signs and symptoms of shock, which makes this client the most unstable. An experienced nurse should care for this client. The client in option 1 is stable because discharge is scheduled for the following day. Therefore, this client does not need to be assigned to the most experienced nurse. The client in option 2 is more in need of custodial nursing care than care from the most experienced nurse. Therefore, the charge nurse could assign a less experienced nurse to this client. The complaints in option 4 usually indicate muscular or pleuritic chest pain. Cardiac chest pain does not fluctuate with inspiration. This client does not require the care of an experienced nurse as much as does the client with signs of shock.
A 70-year-old client tells the nurse about experiencing problems with sleep and requests sleeping medication. Which concept associated with drug therapy and quality of sleep is important for the nurse to explain when providing nursing care for this client? 1. Sedatives are not well tolerated by older adults. 2. Anti-anxiety drugs are the least helpful to support sleep. 3. Effectiveness of hypnotics increases with prolonged use. 4. Melatonin is a drug of choice for long-term use in sleep disorders. The correct answer is 1. Sedatives are not well tolerated by older adults. Rationale: sedatives are not well tolerated by older adults because a decrease in the metabolism and excretion of the drug can result in toxicity. In addition, older adults may experience idiosyncratic effects. Anti-anxiety drugs depress the central nervous system and therefore are helpful in supporting sleep. The effectiveness of hypnotics decreases, not increases, with prolonged use. They should be used only as a short-term intervention because tolerance and rebound insomnia occur in approximately 4 weeks. Although melatonin demonstrates promise as a drug to support sleep, it is not the drug of choice because its safety and efficacy for long-term use are not yet established.
The nurse is teaching the client recently diagnosed with essential hypertension. Which instruction should the nurse provide when discussing exercise? 1. Walk at least 30 minutes a day on flat surfaces. 2. Perform light weightlifting 3 times a week. 3. Recommend high-level aerobics daily. 4. Encourage the client to swim laps once a week. The correct answer is 1. Walk at least 30 minutes a day on flat surfaces. Walking 30 to 45 minutes a day will help to reduce blood pressure, weight, and stress, and will increase a feeling of overall well-being. Isometric exercises should be discouraged because performing them can raise the systolic blood pressure. The client should walk, cycle, jog, or swim daily, but high-level aerobic exercise may increase the client's blood pressure. Swimming laps is recommended, but it should be daily, not once a week. The nurse just received the AM shift report. Which client should the nurse assess first? 1. The client diagnosed with coronary artery disease who has a BP of 170/100. 2. The client diagnosed with deep vein thrombosis who is complaining of chest pain. 3. The client diagnosed with pneumonia who has a pulse oximeter reading of 98%. 4. The client diagnosed with ulcerative colitis who has non-bloody diarrhea. The correct answer is 2. The client diagnosed with deep vein thrombosis who is complaining of chest pain. The chest pain could be a pulmonary embolus secondary to deep vein thrombosis and requires immediate intervention by the nurse. The blood pressure in option 1 is elevated, but it is not life-threatening. A pulse oximeter reading of greater than 93% is within normal limits. Non-bloody diarrhea is an expected sign of ulcerative colitis and would not require immediate intervention by the nurse. The client diagnosed with essential hypertension asks the nurse, "I don't know why the doctor is worried about my blood pressure. I feel just great." Which statement by the nurse would be the most appropriate response? 1. Damage can be occurring to your heart and kidneys even if you feel great. 2. Unless you have a headache, your blood pressure is probably within normal limits. 3. When was the last time you saw your doctor? Does he know you are feeling great? 4. Your blood pressure reflects how well your heart is working. The correct answer is 1. Damage can be occurring to your heart and kidneys even if you feel great. You should select the option that provides the client with correct information in a non-threatening, non-judgmental approach. Even if the client feels great, the blood pressure can be elevated, causing damage to the heart, kidney, and blood vessels. A headache may indicate an elevated blood pressure, but the client with essential hypertension can be asymptomatic and still have a very high blood pressure reading. This response does not answer the client's question as to why the doctor is worried about the client's blood pressure. The blood pressure does not necessarily reflect how well the heart is working. Many other diagnostic tests assess how well the heart is working, including an electrocardiogram, an ultrasound, and a chest X-ray. The client with type 2 diabetes has been admitted into the medical department with a wound on the left leg that will not heal. The HCP prescribes sliding scale insulin. The client tells the nurse, "I don't want to have to take shots. I take pills at home." Which statement is the nurse's best response? 1. If you can't keep your glucose under control with pills, you must take insulin. 2. You should discuss the insulin order with your HCP because you don't want to take it. 3. You are worried about having to take insulin. I will sit down and we can talk. 4. During illness, you may need to take insulin to keep your blood glucose level down. The correct answer is 4. During illness, you may need to take insulin to keep your blood glucose level down. Blood glucose levels elevate during times of stress, surgery, or serious infection. The client with type 2 diabetes may need to be given insulin temporarily to help keep the blood glucose level within normal limits. The statement in option 1 is a threatening type of statement and is not the nurse's best response. Insulin may need to be prescribed in times of stress, surgery, or serious infection. Therefore, the nurse should explain this to the client and not refer the client to the HCP. Option 4 is a therapeutic response, and the client needs to have factual information. Therapeutic responses are used to encourage the client to ventilate feelings. The mother of a teenage girl asks the nurse why her daughter would have many boxes of pseudoephedrine in her room. Which statement is the nurse's best response? 1. Has your child always had allergy problems? 2. Teenagers will try to take care of their own health problems. 3. Has your daughter's behavior at school or at home changed recently? 4. Remove the medication and say nothing to your daughter about it. The correct answer is 3. Has your daughter's behavior at school or at home changed recently? Pseudoephedrine is an antihistamine and is used in the manufacture of methamphetamines. This situation could indicate the teenager is involved with the drug culture, taking or manufacturing drugs. The nurse should assess for signs of drug involvement.
The nurse is teaching a client with polycythemia vera about potential complications from this disease. Which manifestation should the nurse include in the client's teaching plan? Select all that apply. 1. Hearing loss. 2. Visual disturbance. 3. Headache. 4. Orthopnea. 5. Gout. 6. Weight loss. The correct answers are 2, 3, 4, and 5. Polycythemia vera, a condition in which too many red blood cells are produced in the blood serum, can lead to an increase in the hematocrit and hypervolemia, hyperviscosity, and hypertension. Subsequently, the client can experience dizziness, tinnitus, visual disturbances, headaches, or feeling of fullness in the head. The client may also experience cardiovascular symptoms, such as heart failure, and increased clotting time or symptoms of an increased uric acid level, such as painful, swollen joints. Hearing loss and weight loss are not manifestations associated with polycythemia vera.
The nurse in a medical unit is administering 9 o'clock medications. Which medication should the nurse question administering? 1. Acetylcysteine to a client who is coughing forcefully. 2. Cefazolin IV piggyback to a client diagnosed with the flu. 3. Diphenhydramine to a client who is congested. 4. Dextromethorphan to a client who has pneumonia. The correct answer is 1. Acetylcysteine to a client who is coughing forcefully. Acetylcysteine is a mucolytic. An adverse effect of mucomist is bronchospasm. This client should be assessed for bronchospasm before administering a dose of mucomist. Cefazolin is an antibiotic. Antibiotics are frequently administered to clients with viral infections to prevent secondary bacterial infections. This client is considered at risk, or the client would not be in a hospital receiving care. There is no reason to question this medication. Diphenhydramine is an antihistamine. Antihistamines are prescribed for congestion, so there is no reason to question this medication. Dextromethorphan is an antitussive. A symptom of pneumonia is a cough, so there is no reason to question this medication. A baby boy is to be circumcised by the mother's obstetrician. Which of the following actions shows that the nurse is being a patient advocate? 1. Before the procedure, the nurse prepares the sterile field for the physician. 2. The nurse refuses to unclothe the baby until the doctor orders something for pain. 3. The nurse holds the feeding immediately before the circumcision. 4. After the procedure, the nurse monitors the site for signs of bleeding. The correct answer is 2. The nurse refuses to unclothe the baby until the doctor orders something for pain. The nurse is being a patient advocate because the baby is unable to ask for pain medication. The American Academy of Pediatrics has made a policy statement that pain medications be used during all circumcision procedures. Circumcision is a surgical procedure that requires a sterile field and sterile technique. The nurse is performing safe practice in this situation. If a baby feeds immediately before the circumcision, he may aspirate his feeds. This is safe practice. Making sure the baby is not hemorrhaging at the incision site is also an example of safe nursing practice. Nurses perform a variety of roles. Being a safe practitioner is an essential role of the nurse. Just as important, and quite different, however, is the role of patient advocate, that is, providing support for the rights of a client who is unable to speak for or support himself or herself.
An older adult with a history of hypertension is admitted with diagnosis of dehydration. The client is becoming increasingly confused and weak. The client reports taking 1 tablet of hydrochlorothiazide daily, and the prescription is written for 1/2 tablet. The nurse should obtain additional information about 1. Decreased drug half-life of the hydrochlorothiazide. 2. Decreased hepatic blood flow. 3. Increased GI activity. 4. Increased urinary elimination. The correct answer is 2. Aging causes decreased hepatic blood flow. Decreased drug metabolism, which occurs with aging, along with more drug in circulation, means the drug will remain in the body longer and produce greater drug effects. The client has also taken more drug than prescribed, increasing the opportunity for more drug action to occur. When there is decreased metabolism of drugs, an increase in the half-life will occur most especially in the older adult. In older adults, transit time is slower, allowing more drug to be absorbed. Increased urinary elimination would mean that drug elimination could be higher, not lower, and accumulating in the body.
Which side effects should the nurse explain to the male client who is prescribed cimetidine? 1. The medication can cause indigestion and heartburn. 2. The medication can cause impotence and gynecomastia. 3. The medication can cause insomnia and hypervigilance. 4. The medication can cause Zollinger-Ellison syndrome. The correct answer is 2. The medication can cause impotence and gynecomastia. Cimetidine is an H2 blocker. Over time, cimetidine can cause males to become impotent, have decreased libido, and have breast development. Cimetidine, an H2 blocker, is used to treat indigestion and heartburn. Cimetidine can cause lethargy and somnolence, not insomnia and hypervigilance. Cimetidine is used to treat Zollinger-Ellison syndrome, a syndrome characterized by hypersecretion of gastric acid and the formation of peptic ulcers. Which child can be discharged without further evaluation? 1. A 2-year-old who has had 24 hours of watery diarrhea that has changed to bloody diarrhea in the past 12 hours. 2. A 3-year-old who had a relapse of 1 diarrhea episode after restarting a normal diet. 3. A 6-year-old who has been having vomiting and diarrhea for 2 days and has decreased urine output. 4. A 10-year-old who has just returned from a scout camping trip and has had several episodes of diarrhea. The correct answer is 2. A 3-year-old who had a relapse of 1 diarrhea episode after restarting a normal diet. It is common for children to have a relapse of diarrhea after resuming a regular diet. Diarrhea containing blood needs further evaluation to determine the source of the blood, and the child's blood counts and electrolyte balance need to be tested. Children who have had vomiting and diarrhea for more than 2 days require evaluation to determine whether IV rehydration and hospital admission are necessary. Diarrhea following a camping trip needs further evaluation because it may be caused by bacteria or parasites. You should eliminate answers 1 and 3 because they describe children who may have altered electrolytes and blood counts due to prolonged diarrhea. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client diagnosed with inflammatory bowel disease is prescribed sulfasalazine. Which intervention should the nurse implement when administering this medication? 1. Ensure the client drinks at least 2,000 milliliters of water daily. 2. Administer the medication once a day with breakfast. 3. Explain that the medication may cause slight bruising. 4. Assess the client's stool for steatorrhea and mucus. The correct answer is 1. Ensure the client drinks at least 2,000 milliliters of water daily. Sulfasalazine is a sulfonamide antibiotic. Increasing fluid intake dilutes the drug, which helps to prevent crystalluria from occurring. The medication is administered every 6 to 8 hours, not once a day. Instruct the client to report any bruising or bleeding because it could be a sign of a drug-induced blood disorder. This medication will not cause fat, frothy stools. Therefore, the nurse does not need to assess the stool. The nurse is caring for a 3-month-old being evaluated for possible Hirschsprung disease. His parents call the nurse and show her his diaper containing a large amount of mucus and bloody diarrhea. The nurse notes that the infant is irritable and his abdomen appears very distended. Which should be the nurse's next action? 1. Reassure the parents that this is an expected finding and not uncommon. 2. Call a code for a potential cardiac arrest and stay with the infant. 3. Immediately obtain all vital signs with a quick head-to-toe assessment. 4. Obtain a stool sample for occult blood. The correct answer is 3. Immediately obtain all vital signs with a quick head-to-toe assessment. All vital signs need to be evaluated because the child with enterocolitis can quickly progress to a state of shock. A quick head-to-toe assessment will allow the nurse to evaluate the child's circulatory system. All cases of bloody diarrhea need to be evaluated because this may be a sign of enterocolitis, which is a potentially fatal complication of Hirschsprung disease. For option 2, although this is a potentially critical complication, calling a code is not necessary at this time because the infant is irritable and not unconscious. It is not a priority to test the stool for occult blood because there is obvious blood in the sample. You should select answer 3 because there is not enough information to determine the status of the child. Obtaining vital signs will help the nurse to assess the situation. The nurse is administering a beta blocker to the client diagnosed with essential hypertension. Which intervention should the nurse implement? 1. Notify the healthcare provider if the potassium level is 3.8 milliequivalents per liter. 2. Question administering the medication if the BP is less than 90/60. 3. Do not administer the medication if the client's radial pulse is greater than 100 beats per minute. 4. Monitor the client's BP while he or she is lying, standing, and sitting. The correct answer is 2. Question administering the medication if the BP is less than 90/60. The nurse should question administering the beta blocker if the BP is low because this medication will cause the blood pressure to drop even lower, leading to hypotension. The potassium level is within normal limits, and it is not usually checked prior to administering beta blockers. The nurse would not administer the medication if the apical pulse were less than 60 beats per minute. The nurse needs to assess the blood pressure only once prior to administering the medication. The nurse is teaching the dietary approaches to stop hypertension diet to a client diagnosed with essential hypertension. Which statement indicates that the client understands teaching concerning the DASH diet? 1. I should eat at least 4 to 5 servings of vegetables a day. 2. I should eat meat that has a lot of white streaks in it. 3. I should drink no more than 2 glasses of whole milk a day. 4. I should decrease my grain intake to no more than twice a week. The correct answer is 1. I should eat at least 4 to 5 servings of vegetables a day. The DASH diet has proved beneficial in lowering blood pressure. It recommends eating a diet high in vegetables and fruits. The DASH diet recommends 2 or fewer servings of lean meats, which have very few white streaks. The white streaks indicate the meat is high in fat. The DASH diet recommends 2 to 3 servings of non-fat or low-fat milk, not whole milk. The DASH diet recommends 7 to 8 servings of grain a day.
Which statement reflects hospice care in the healthcare delivery system? Select all that apply. 1. Clients predicted to have less than half a year to live receive services. 2. It assists families to care for their dying relatives at home. 3. Care is less expensive than in the acute care setting. 4. Support is given to the client and family members. 5. Hospice is a method of care rather than a location. The correct answers are 1. Clients predicted to have less than half a year to live receive services. 2. It assists families to care for their dying relatives at home. 3. Care is less expensive than in the acute care setting. 4. Support is given to the client and family members. And 5. Hospice is a method of care rather than a location. Rationale. To be eligible for hospice services, individuals are predicted to have less than 6 months to live. It is a service to support clients and their families through the process of dying. Most hospice care is delivered in clients' homes supported by a team of healthcare providers and volunteers. However, there are inpatient hospice programs, palliative care units in hospitals, and residential hospice settings. The majority of hospice care is provided in the home. The home is a less expensive setting than other healthcare settings because family members provide most of the care, supported by a team of professionals, non-professionals, and volunteers. Hospice services provide supportive care, physical care, and promotion of the quality of life for the terminally ill client and family members. In addition, hospice care assists family members with bereavement and adjustment after the death of the client. Hospice is not a location, but a concept. It provides supportive, palliative services that focus on managing pain, treatment of symptoms, and helping clients maintain their quality of life so they can live the remainder of their lives to the fullest.
The HCP prescribed amoxicillin clavulanate for a client diagnosed with chronic obstructive pulmonary disease who has a cold. Which intervention should the nurse implement? 1. Discuss the prescription with the HCP because antibiotics do not help viral infections. 2. Teach the client to take all the antibiotics as ordered. 3. Encourage the client to seek a second opinion before taking the medication. 4. Ask the client if he or she is allergic to sulfa drugs or shellfish. The correct answer is 2. Teach the client to take all the antibiotics as ordered. Amoxicillin clavulanate is an antibiotic. Clients prescribed antibiotics should always be taught to take all the medication as ordered to prevent resistant strains of bacteria from developing. Antibiotics do not treat viral infections, but HCPs will frequently prescribe prophylactic antibiotics for clients with comorbid conditions, such as COPD, to prevent a secondary bacterial infection. There is no reason for a second opinion, as this is standard medical practice. This is a penicillin preparation, not a sulfa medication or iodine.
Following diagnosis of angina pectoris, a client reports being unable to walk up 2 flights of stairs without pain. Which of the following measures would most likely help the client prevent this problem? 1. Climb the steps early in the day. 2. Rest for at least an hour before climbing the stairs. 3. Take a nitroglycerin tablet before climbing the stairs. 4. Lie down after climbing the stairs. The correct answer is 3. Take a nitroglycerin tablet before climbing the stairs. Rationale. Nitroglycerin may be used prophylactically before stressful physical activities, such as stair climbing, to help the client remain pain-free. Climbing the stairs early in the day would have no impact on decreasing pain episodes. Resting before or after an activity is not as likely to help prevent an activity-related pain episode. The physician refers the client with unstable angina for a cardiac catheterization. The nurse explains to the client that this procedure is being used in this specific situation to 1. Open and dilate blocked coronary arteries. 2. Assess the extent of arterial blockage. 3. Bypass obstructed vessels. 4. Assess the functional adequacy of the valves and heart muscle. The correct answer is 2. Assess the extent of arterial blockage. Rationale. Cardiac catheterization is done in clients with angina primarily to assess the extent and the severity of the coronary artery blockage. A decision about medical management, angioplasty, or coronary artery bypass surgery will be based on the catheterization results. Coronary bypass surgery would be used to bypass obstructed vessels, although cardiac catheterization can be used to assess the functional adequacy of the valves and heart muscle. In this case, the client has unstable angina and therefore would need the procedure to assess the extent of arterial blockage.
In the care of a patient with gastroesophageal reflux disease, which task would be appropriate to delegate to assistive personnel? 1. Sharing successful strategies for weight reduction. 2. Encouraging the patient to express concerns about lifestyle modification. 3. Reminding the patient not to lie down for 2 to 3 hours after eating. 4. Explaining the rationale for eating small frequent meals. The correct answer is 3. Reminding the patient not to lie down for 2 to 3 hours after eating. Rationale. Reminding the patient to follow through on advice given by the nurse is an appropriate task for the AP. The nurse should take responsibility for teaching rationale, discussing strategies for the treatment plan, and assessing patient concerns.
A nurse is facilitating a support group for people who are coping with the death of a significant other. Which client behavior reflects complicated grieving? 1. Remarrying within 6 months after the death of a wife. 2. Being continuously angry 3 months after the death of a parent. 3. Exhibiting indicators of depression 9 months after the death of a husband. 4. keeping a child's room unchanged for 4 years after the death of the child. The correct answer is 4. Keeping a child's room unchanged for 4 years after the death of the child. Rationale. Keeping a deceased child's room unchanged for years is outside the usual limits of grieving. Often, a person can get stuck in a stage of grieving and is unable to progress to the next stage. Keeping a room unchanged for years reflects an inability to face the reality of the loss or to deal with the feelings associated with the loss.
The female client diagnosed with epilepsy tells the nurse, "I am very scared to get pregnant since I am taking medication for my epilepsy." Which statement is the nurse's best response? 1. You are scared because you take medication for your epilepsy. 2. Can you tell me more about what is concerning you? 3. You should not get pregnant when you are taking anticonvulsants. 4. Have you discussed your concerns with your HCP? The correct answer is 2. Can you tell me more about what is concerning you? Rationale. Option 1 is a therapeutic response that is used to encourage the client to ventilate feelings, but the nurse should provide factual information to this client. The nurse should explore the reasons for the client's fears in order to be able to give her information that would help her make a decision about becoming pregnant, as many anticonvulsant medications have teratogenic properties. A female client with epilepsy can give birth to an infant without epilepsy. The client should discuss a potential pregnancy with a significant other, but this is not addressing the client's concerns.
The nurse is planning a treatment and prevention program for chronic bowel incontinence for an older patient. Which intervention should the nurse try first? 1. Administer a glycerin suppository 15 minutes before evacuation time. 2. Insert a rectal tube at specified intervals each day. 3. Assist a patient to the commode or toilet 30 minutes after meals. 4. Use incontinence briefs or adult-sized diapers. The correct answer is 3. Assist a patient to the commode or toilet 30 minutes after meals. Rationale. The goal of bowel training is to establish a pattern that mimics normal defecation, and many people have the urge to defecate after a meal. If this is not successful, a suppository can be used to stimulate the urge. The use of incontinence briefs is embarrassing for the patient, and they must be changed frequently to prevent skin breakdown. Routine use of rectal tubes is not recommended because of the potential for damage to the mucosa and sphincter tone.
The parents of a 4-year-old ask the nurse how to manage their child's constipation. Select the nurse's best response. 1. Add 2 ounces of apple or pear juice to the child's diet. 2. Be sure your child eats a lot of fresh fruit such as apples and bananas. 3. Encourage your child to drink more fluids. 4. Decrease bulky foods such as whole grain breads and brown rice. The correct answer is 3. Encourage your child to drink more fluids. Increasing fluid consumption helps to decrease the hardness of the stool. Whole grain bread and brown rice are high in fiber and help decrease constipation. 2 ounces of apple juice is most likely not a sufficient quantity to alter a 4-year-old child's bowel movements. Although fresh fruits help decrease constipation, option 3 is the better answer choice than option 2. Answer 1 decreases constipation in an infant, but not in a preschooler.
In the care of a patient with acute viral hepatitis, which task would be delegated to assistive personnel? 1. Emptying the bedpan while wearing gloves. 2. Engaging the patient in diversional activities. 3. Monitoring dietary preferences. 4. Reporting signs and symptoms of jaundice. The correct answer is 1. Emptying the bedpan while wearing gloves. Rationale. The AP should use infection control precautions for the protection of self, employees, and other patients. Monitoring is a nurse responsibility. APs can report valuable information. However, they are not responsible for detecting signs and symptoms that can be subtle or hard to detect, such as skin changes. Engaging patients in diversional activities is the ideal. However, it is rarely possible on a busy medical surgical unit. After arriving at a home location that has a history of domestic violence, a home care nurse believes that the environment may be unsafe. Which is the best nursing action? 1. Leave the home immediately. 2. Defuse the situation in the home. 3. Call the police for a personal escort. 4. Complete the visit quickly while remaining alert. The correct answer is 1. Leave the home immediately. Rationale. Nurses must remove themselves immediately from any environment that they believe is unsafe. Attempting to defuse the situation may make the situation worse and place the nurse at additional risk. Calling the police may inflame the situation or take too long for an officer to arrive. Attempting to complete the visit may place the nurse at additional risk.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A nurse identifies the healthcare needs of the members of a community, which is the nurse's most efficient initial approach to meet these needs. 1. Involve community leaders to work within the political arena to obtain funding for programs. 2. Write research grants to explore the community's health needs in more detail. 3. Design educational programs that address the identified community needs. 4. Make clients aware of the resources in the community. The correct answer is 4. Make clients aware of the resources in the community. Rationale. Option 4 is the most efficient initial approach to meeting the identified needs of the members of the community. The use of currently available resources is more efficient than the other options presented. Option 1 is not the most efficient approach. This may be necessary if present resources are not available to meet the needs of the community. In Option 2, the health needs of the members of the community are identified already. Further study at this time does not appear to be appropriate. In Option 3, designing educational approaches is not the most efficient approach. This may eventually be done after an action in another option is implemented first. A home care nurse is providing care for a family supporting a client with a chronic illness, which is the most important factor the nurse should teach caregivers who care for a family member who has a stable but chronic illness and is living in the home. 1. Have extra equipment and supplies for emergencies. 2. Plan a daily and monthly schedule of activities. 3. Keep a daily journal of the client status. 4. Tend to themselves as well as the client. The correct answer is 4. Tend to themselves as well as the client. Rationale. Caregiver role strain experienced by a family member is a serious concern of home care nurses. Caregivers often fail to address their own health needs because of the extraordinary burden of the caregiver role, which can jeopardize their own health and well-being. Caregivers should be encouraged to delegate responsibilities to other family members, get adequate sleep, rest, and nutritional intake, seek assistance from agencies that provide respite services, take time for leisure activities and a vacation, and join a caregiver support group. Option 1 is a good idea. It is not the most important factor a home care nurse can convey to a person caring for a family member in the home. Option 2 might contribute to efficiency, as well as gaining a feeling of control over the activities that must be accomplished. It is not the most important factor a home care nurse can convey to a person caring for a family member in the home.
The nurse is teaching the client diagnosed with arterial occlusive disease. Which interventions should the nurse include in the teaching? Select all that apply. 1. Wash legs and feet daily in warm water. 2. Apply moisturizing cream to the feet. 3. Buy shoes in the morning hours only. 4. Do not wear any type of knee stocking. 5. Wear clean white cotton socks. The correct answers are 1. Wash legs and feet daily in warm water. 2. Apply moisturizing cream to the feet. 4. Do not wear any type of knee stocking. And 5. Wear clean white cotton socks. Cold water causes vasoconstriction, and hot water may burn the client's feet. Therefore, warm water should be recommended. Moisturizing prevents drying of the feet. Option 4 will further decrease circulation to the legs. Colored socks have dye, and dirty socks may cause foot irritation that may lead to breaks in the skin. Option 3 could be eliminated as a correct answer right off the bat because of the word only, which is an absolute word. There are very few absolutes in healthcare. A nurse completes an incident report after a client falls while getting out of bed unassisted. Which is the purpose of this report? 1. Ensure that all parties have an opportunity to document what happened. 2. Help establish who is responsible for the situation. 3. Make data available for quality control analysis. 4. Document the situation on the client's chart. The correct answer is 3. Make data available for quality control analysis. Incident reports help to identify patterns of risk so that corrective action plans can take place. The nurse who identified or created the potential or actual harm completes the incident report. The report identifies the people involved in the incident, describes the incident, and records the date, time, location, actions taken, and other relevant information. Documentation should be as factual as possible and avoid accusations. Questions of liability are the responsibility of the courts. An incident report is not part of the client's clinical record, and reference to the report should not be made in the client's clinical record.
The nurse would be most concerned about a prescription for a total parenteral nutrition fat emulsion for a patient with which condition? 1. Gastrointestinal obstruction. 2. Severe anorexia nervosa. 3. Chronic diarrhea and vomiting. 4. Fractured femur. The correct answer is 4. Fractured femur. Rationale. A patient with a fractured femur is at risk for fat embolism, so a fat emulsion should be used with caution. TPN is commonly used for patients with GI obstruction, severe anorexia nervosa, and chronic diarrhea or vomiting.
A nurse cares for a group of clients. A client experiencing which of the following situations does the nurse anticipate will have the hardest time coping? 1. Scheduled for a biopsy. 2. Unable to control the course of illness. 3. Challenged by a multiplicity of stressors. 4. Having to relocate to an assisted living facility. The correct answer is 3. Challenged by a multiplicity of stressors. Rationale. As the multiplicity of stressors increases, it becomes harder for a person to cope. As each stress is added, the accumulated impact is greater than just the sum of each individual stressor.
How should the nurse instruct the client with unstable angina to use sublingual nitroglycerin tablets when chest pain occurs? 1. Sit down and then take one tablet every 2 to 5 minutes until the pain stops. 2. Sit down and then take one tablet and rest for 15 minutes. Call the physician if pain persists after 15 minutes. 3. Sit down and then take one tablet. Then if the pain persists, take additional 2 tablets in 5 minutes. Call the physician if pain persists after 15 minutes. 4. Sit down and then take one tablet. If pain persists after 5 minutes, call 911. The correct answer is 4. Sit down and then take one tablet. If pain persists after 5 minutes, call 911. Rationale. The nurse should instruct the client that correct protocol for using sublingual nitroglycerin involves immediate administration when chest pain occurs. Sublingual nitroglycerin appears in the bloodstream within 2 to 3 minutes and is metabolized within about 10 minutes. The client should sit down and place the tablet under the tongue. If the chest pain is not relieved within 5 minutes, the client should call 911. Although some physicians may recommend taking a second or third tablet spaced 5 minutes apart and then calling for emergency assistance, it is not appropriate to take 2 tablets at once. Nitroglycerin acts within 2 to 3 minutes, and the client should not wait 15 minutes to take further action. The client should call 911 to obtain emergency help rather than calling the physician.
For patients with peptic ulcer disease, what is the most important lifestyle modification? 1. Avoiding caffeine. 2. Decreasing alcohol intake. 3. Smoking cessation. 4. Controlling stress. The correct answer is 3. Smoking cessation. Rationale. Smoking is associated with peptic ulcer disease. The other lifestyle modifications may be desirable, but the current evidence does not show strong linkage to the development of or recovery from peptic ulcer disease.
The nurse is assessing the client diagnosed with congestive heart failure. Which signs and symptoms would indicate that the medical treatment has been effective? 1. The client's peripheral pitting edema has gone from 3+ to 4+. 2. The client is able to take the radial pulse accurately. 3. The client is able to perform ADLs without dyspnea. 4. The client has minimal jugular vein distension. The correct answer is 3. The client is able to perform ADLs without dyspnea. Being able to perform activities of daily living without shortness of breath would indicate the client's condition is improving. The client's heart is a more effective pump and can oxygenate the body better without increasing fluid in the lungs. Pitting edema changing from 3+ to 4+ indicates a worsening of the CHF. The client's ability to take the radial pulse would evaluate teaching, not medical treatment. Any jugular vein distension indicates that the right side of the heart is failing, which would not indicate effective medical treatment. When asked to determine whether treatment is effective, the test taker must know the signs and symptoms of the disease being treated. An improvement in the signs and symptoms indicates effective treatment.
The long-term care facility nurse is caring for a client diagnosed with a cerebrovascular accident 6 months ago who has residual cognitive deficits. The HCP has ordered alprazolam to be administered at bedtime. Which interventions should the nurse initiate for this client? Select all that apply. 1. Offer toileting every 2 hours. 2. Move the client close to the nurse's station. 3. Administer the medication at 2100. 4. Administer the medication with a full glass of water. 5. Do not administer if the client's apical pulse is less than 60 beats per minute. The correct answers are 1. Offer toileting every 2 hours. 2. Move the client close to the nurse's station. And 3. Administer the medication at 2100. Rationale: alprazolam, an anti-anxiety medication, has a side effect of drowsiness, which is why the HCP chose this medication for the client, to help the client rest at night. The client has cognitive deficits and should be on fall precautions. So it is hoped that assisting the client to the bathroom every 2 hours will prevent the client from falling while trying to get to the bathroom. The client at risk for falling should be as near the nursing station as possible. This allows the staff to keep a closer watch on the client. The medication is ordered for bedtime, usually 2100 in most healthcare facilities. Giving the medication with a full glass of water would increase the client's need to get up during the night to use the bathroom, increasing the risk of falling. This medication does not require the apical pulse being monitored prior to administering the medication.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse has written an outcome goal, demonstrates tolerance for increased activity for a client diagnosed with congestive heart failure. Which intervention should the nurse implement to assist the client to achieve this outcome? 1. Measure intake and output. 2. Provide 2-gram sodium diet. 3. Weigh client daily. 4. Plan for frequent rest periods. The correct answer is 4. Plan for frequent rest periods. Scheduling activities and rest periods allows the client to participate in his or her own care and addresses the desired outcome. Measuring the intake and output is an appropriate intervention to implement for a client with CHF, but it does not address getting the client to tolerate activity. Dietary sodium is restricted in clients with CHF, but this is an intervention for decreasing fluid volume, not for increasing tolerance for activity. Daily weighing monitors fluid volume status, not activity tolerance. With questions involving nursing diagnoses or goals and outcomes, you should realize that all activities referred to in the answer options may be appropriate for the disease, but may not be specific for the desired outcome.
The nurse in the ICU is caring for a client diagnosed with a left cerebral artery thrombotic stroke who received a thrombolytic medication in the ED. Which intervention should be implemented? 1. Administer oral ticlopidine. 2. Place the client in the Trendelenburg position. 3. Keep the client turned to the right side and high Fowler's position. 4. Monitor heparin infusion. The correct answer is 4. Monitor heparin infusion. Rationale: ticlopidine and antiplatelet may be ordered in the future once the cause of the thrombus is determined, but this would not be ordered in the ICU. The Trendelenburg position is head down and would increase intracranial pressure. There is no reason to restrict the client to lying on the right side, and high Fowler's is sitting upright. This would be a difficult position for the client to maintain. The client should have the head of the bed elevated approximately 30 degrees to decrease intracranial pressure by gravity drainage. The anticoagulant medication heparin is administered to prevent clot reformation after lysis of the clot by the thrombolytic, and its infusion should be monitored.
A woman is concerned about her children accidentally ingesting her husband's prescribed medications. Where should the home care nurse teach the mother to keep medications? 1. On a high shelf. 2. In a locked cabinet. 3. In a medicine cabinet in the bathroom. 4. On a shelf in the back of the refrigerator. The correct answer is 2. In a locked cabinet. Rationale. A locked area is the safest place to store prescribed as well as over-the-counter medications to prevent accidental ingestion by children. A high shelf, medicine cabinet in the bathroom, a shelf in the back of the refrigerator are not safe places to keep medications. Children have natural curiosity, problem-solving abilities, and the agility to climb to a top shelf. During the process of performing a community assessment, the nurse invites members of the community to come to a meeting and share opinions and concerns about a particular issue, which is this method of data collection. 1. An opinion survey. 2. A community forum. 3. A demographic assessment. 4. An observation of participants. The correct answer is 2. A community forum. Rationale. A forum is defined as an opportunity for open discussion, inviting people from the community to share opinions and concerns about a particular issue for the purpose of collecting data is called a community forum. An opinion survey is designed to collect each individual person's perspective about the problem being studied. Results are tallied to identify the major concerns. Opinion surveys generally are questionnaires. A demographic assessment is a quantitative study of the characteristics of a population. A demographic assessment might include information such as distribution of the population by gender, size, growth, density, and ethnicity. Direct observation is a method of data collection that may be used to determine whether individuals follow a specific procedure or behave in an expected manner. A male nurse tells an older male patient that he needs to perform a digital examination of the rectum to check for possible fecal impaction. The patient responds, "I'm not letting any male nurse get near me." What should the nurse do first? 1. Explain that the procedure is a nursing action, not a sexual advance. 2. Ask the charge nurse to reassign that patient to a different nurse. 3. Document that the patient refused to allow the examination. 4. Ask the patient if the presence of a female staff member would be acceptable. The correct answer is 4. Ask the patient if the presence of a female staff member would be acceptable. Rationale. The nurse is likely to feel upset, even angry. However, ideally, the nurse focuses on the patient and tries to find a solution that allows the care to continue. Having a female witness in the room may reassure the patient that nothing untoward will happen. If the patient continues to express hostility and rejection, then the nurse could ask the charge nurse to reassign the patient. In cases of emergency, the nurse would acknowledge the patient's feelings, but politely and firmly explain that the intervention can't be delayed. All attempts and interventions should be documented.
Which factor is unique to malpractice when comparing negligence and malpractice? 1. The action did not meet standards of care. 2. Inappropriate care is an act of commission. 3. There is harm to the client as a result of the care. 4. There is a contractual relationship between the nurse and client. The correct answer is 4. There is a contractual relationship between the nurse and client. Only malpractice is misconduct performed in professional practice, where there is a contractual relationship between the client and nurse that results in harm to the client. There is a violation of standards of care with both negligence and malpractice. Negligence and malpractice both involve acts of either commission or omission. The client must have sustained injury, damage, or harm with both negligence and malpractice. A client with peptic ulcer disease reports being nauseated most of the day and now feeling lightheaded and dizzy. Based upon these findings, which nursing actions would be most appropriate for the nurse to take? Select all that apply. 1. Administering an antacid hourly until nausea subsides. 2. Monitoring the client's vital signs. 3. Notifying the physician of the client's symptoms. 4. Initiating oxygen therapy. 5. Reassessing the client in an hour. The correct answers are 2. Monitoring the client's vital signs, and 3. Notifying the physician of the client's symptoms. The symptoms of nausea and dizziness in a client with peptic ulcer disease may be indicative of hemorrhage and should not be ignored. The appropriate nursing actions at this time are for the nurse to monitor the client's vital signs and notify the physician of the client's symptoms. To administer an antacid hourly or to wait 1 hour to reassess the client would be inappropriate. Prompt intervention is essential in a client who is potentially experiencing a gastrointestinal hemorrhage. The nurse would notify the physician of assessment findings and then initiate oxygen therapy if prescribed by the physician.
Metoprolol is added to the pharmacologic therapy of a diabetic female diagnosed with stage 2 hypertension, initially treated with furosemide and ramipril. An expected therapeutic effect is 1. Decrease in heart rate. 2. Lessening of fatigue. 3. Improvement in blood sugar levels. 4. Increase in urine output. The correct answer is 1. The effect of a beta blocker is a decrease in heart rate, contractility, and afterload, which leads to a decrease in blood pressure. The client at first may have an increase in fatigue when starting the beta blocker. The mechanism of action does not improve blood sugar or urine output.
The female client is being admitted to a medical unit with a diagnosis of pneumonia. Which intervention would the nurse implement? Rank in order of performance. 1. Start an IV access line. 2. Administer the IVPB antibiotic. 3. Teach to notify the nurse of any vaginal itching. 4. Obtain sputum and blood cultures. 5. Place an identity band on the client. The correct order is 5. Place an identity band on the client. 4. Obtain sputum and blood cultures. 1. Start an IV access line. 2. Administer the IVPB antibiotic. And 3. Teach to notify the nurse of any vaginal itching. The laboratory technician who will draw the blood cultures will need the band to identify the client before drawing the specimen, and the nurse will need the band before administering the medication. Checking for the right client is one of the 6 rights of medication administration. Cultures are obtained prior to the initiation of antibiotics to prevent skewing of the results. An IV line must be initiated before the nurse can administer IV medications. IV antibiotics should be administered within 1 to 2 hours of the order being written. This should always be considered a now medication. Superinfections are a potential complication of antibiotic therapy. Vaginal yeast infections occur when the good bacteria are killed off by the antibiotic. Diarrhea from destruction of intestinal flora is also a possibility. A nurse is teaching a mother how to care for her 3-day-old son's circumcised penis. Which of the following actions demonstrates that the mother has learned the information? 1. The mother cleanses the glands with a cotton swab dipped in hydrogen peroxide. 2. The mother covers the glands with antifungal ointment after rinsing off any discharge. 3. The mother squeezes soapy water from the washcloth over the glands. 4. The mother replaces the dry, sterile dressing before putting on the diaper. The correct answer is 3. The mother squeezes soapy water from the washcloth over the glands. Squeezing soapy water over the penis cleanses the area without irritating the site and causing the site to bleed. Hydrogen peroxide is not used when cleansing the circumcised penis. Antifungals are not indicated in this situation. Dry dressings are not applied to the circumcised penis. It is, however, usually recommended to liberally apply petroleum jelly to the site before diapering. The petroleum jelly may be applied directly to the penis via a sterile dressing or via a petroleum jelly impregnated gauze. The circumcised penis has undergone a surgical procedure, but to apply a dry dressing is potentially injurious. If the dressing adheres to the newly circumcised penis, the incision could bleed. You should be aware that with routine cleaning, as cited previously, circumcisions usually heal quickly and rarely become infected. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Which intervention would be most likely to assist a client with hypertension in maintaining an exercise program? 1. Giving the client a written exercise program. 2. Explaining the exercise program to the client's spouse. 3. Reassuring the client that he or she can do the exercise program. 4. Tailoring a program to the client's needs and abilities. The correct answer is 4. Tailoring or individualizing a program to the client's lifestyle has been shown to be an effective strategy for changing health behaviors. Providing a written program. explaining the program to the client's spouse, and reassuring the client that he or she can do the program may be helpful, but are not as likely to promote adherence as individualizing the program.
The nurse is preparing to administer esomeprazole. Which intervention should the nurse implement? Select all that apply. 1. Order an infusion pump for the client. 2. Elevate the client's head of the bed. 3. Check the client's ID with the medication administration record. 4. Check for allergies to cephalosporin. 5. Ask the client his or her date of birth. The correct answers are 2. Elevate the client's head of the bed. 3. Check the client's ID with the medication administration record. And 5. Ask the client his or her date of birth. The head of the bed is elevated for the client to be able to swallow the medication. The nurse must check the medication administration record with the client's ID band to ensure the correct client is receiving the medication. The Joint Commission requires that 2 patient identifiers be used to determine the right patient. Most healthcare facilities use the client's name and date of birth as these identifiers. An IV pump is not needed. Esomeprazole is a PPI, not a cephalosporin. Cephalosporins are a class of antibiotics.
The 44-year-old female client presents to the emergency department diagnosed with a stroke. Which of the client's current medication regimen is a risk factor for developing a stroke? 1. Propranolol. 2. Furosemide. 3. Estradiol/norgestimate. 4. Metformin. The correct answer is 3. Estradiol/norgestimate. Rationale: propranolol, a beta blocker, is administered for cardiac dysrhythmias and hypertension and for migraine headache prophylaxis. The medication could help prevent a stroke by lowering the blood pressure. Furosemide is a loop diuretic. Loop diuretics have an indirect ability to lower the blood pressure by decreasing the volume of fluid in the body. This would decrease the risk of a stroke. Estradiol/norgestimate is a combination hormone used to prevent conception. Combination oral contraceptives have been associated with venous and arterial thromboembolism, pulmonary embolism, myocardial infarction, and thrombotic stroke. Adverse reaction to metformin glucophage, a biguanide, is lactic acid buildup, not stroke.
The client diagnosed with a severe acute exacerbation of Crohn's disease is prescribed total parenteral nutrition, TPN. Which interventions should the nurse implement when administering TPN? Select all that apply. 1. Monitor the client's glucose level every 6 hours. 2. Administer the TPN on an IV pump. 3. Assess the peripheral IV site every 4 hours. 4. Check the TPN according to the 6 rights prior to administering. 5. Encourage the client to eat all of the food offered at meals. The correct answers are 1. Monitor the client's glucose level every 6 hours. 2. Administer the TPN on an IV pump. And 4. Check the TPN according to the 6 rights prior to administering. TPN is 50% dextrose. Therefore, the client's blood glucose level should be checked every 6 hours. Sliding scale regular insulin coverage is usually ordered. TPN should always be administered using an IV pump and not via gravity. Fluid volume resulting from an overload of TPN could cause a life-threatening hyperglycemic crisis. TPN must be administered via a subclavian line because a peripheral line will collapse as a result of the hyperosmolarity of the TPN and phlebitis may occur. The client with severe acute exacerbation of Crohn's is NPO to rest the bowel. When on TPN, the client is usually NPO because the TPN provides all necessary nutrients. Therefore, the nurse would not encourage the client to eat food.
A hospice nurse is providing emotional support for 8 young children of a dying mother. At which age do children first recognize that death is irreversible, universal, and natural? 1. 9 years of age. 2. 6 years of age. 3. 15 years of age. 4. 12 years of age. The correct answer is 1. 9 years of age. Rationale: a 9-year-old child has a more realistic understanding of death than a younger child and recognizes that death is universal, irreversible, and natural. A 9-year-old child has a beginning knowledge of his or her own mortality and may fear death. A 6-year-old child is developing an understanding of the differences among the concepts of past, present, and future. A 6-year-old child believes that death is temporary, can be caused by bad thoughts, and may be a punishment, and that magic can make the dead person alive. Recognizing that death is irreversible, universal, and natural occurs at an earlier age than 15 years. Recognizing that death is irreversible, universal, and natural occurs at an earlier age than 12 years. A nurse is facilitating a mother's class, and the women begin discussing experiences that reflect the intellectual development of their children. Each woman describes a situation that reflects one of the stages of Jean Piaget's theory about logical thinking. Place the situations described in order, beginning with the sensor-motor stage and ending with formal operations. 1. My son touched the radiator and got burned. He'll never do that again. 2. My son is learning math and is getting 100s on his tests. He is so smart. 3. My daughter is on the debating team in school. We go to inter-school meets. 4. My daughter asked an obese lady if she had a baby in her stomach. I was so embarrassed. The correct order is 1. My son touched the radiator and got burned. He'll never do that again. 4. My daughter asked an obese lady if she had a baby in her stomach. I was so embarrassed. 2. My son is learning math and is getting 100s on his tests. He is so smart. 3. My daughter is on the debating team in school. We go to inter-school meets. Rationale. The sensor-motor stage, birth to 2 years, is governed by sensations in which simple learning takes place. It progresses from reflex activity through repetitive behaviors to imitative behavior. These children are curious, experiment, and learn primarily through trial and error. The preoperational stage, 2 to 7 years, involves thinking that is concrete and tangible. These children cannot reason beyond the observable. Also, their thinking is transductive. That is, knowledge of one characteristic is transferred to another. The concrete operational stage, 7 to 11 years, reflects an increasing ability to use symbols and understand relationships between things and ideas. Judgments are made based on what they reason rather than just what they see. Also, they develop the concept of conservation. That is, physical remain the same even though outward appearances may change. The formal operational stage, 11 to 15 years, involves thinking that is abstract, theoretical, philosophical, and hypothetical. Thinking is characterized by flexibility, adaptability, and drawing logical conclusions. A nurse is assessing a 4-year-old child's growth and development. Which activity should the nurse expect the child to be capable of performing? Select all that apply. 1. Dresses self. 2. Uses toy tools. 3. Hops on 1 foot. 4. Rides a 2-wheel bicycle. 5. Swims using the freestyle stroke. The correct answers are 1. Dresses self. 2. Uses toy tools. And 3. Hops on 1 foot. Rationale. Preschool-age children have the fine motor skills to open and close zippers and buttons. Preschool-age children have the motor skills necessary to manipulate a toy tool, such as a hammer. Preschool-age children have the gross motor skills and balance to be able to hop and skip on 1 foot, balance on 1 foot, and perform a broad jump. Preschool-age children do not have the strength and balance to ride a 2-wheel bicycle. A preschooler usually can ride a tricycle. School-age children, not preschool-age children, usually are able to ride a 2-wheel bicycle. Preschool-age children do not have the strength and coordination to swim using the freestyle stroke. Some preschool-age children are able to do the doggy paddle. School-age children, not preschool-age children, usually are able to swim using the freestyle stroke. An older adult woman who has left-sided paralysis because of a brain attack is being cared for by a daughter in the home in which the daughter lives with her husband. The home care nurse interviews each member of the family separately, based on the significant information in each interview, which is the most important initial nursing intervention. 1. Be sensitive to the client's cultural beliefs. 2. Arrange respite care for the client's daughter. 3. Reinforce the daughter's responsibility to care for her mother. 4. Encourage the husband to help his wife with the care of his mother-in-law. The correct answer is 1. Be sensitive to the client's cultural beliefs. Rationale. Beliefs and values usually are held long-term and are ingrained within one's view of self. It is essential that nurses respect the client's beliefs and values, particularly for non-traditional healing practices, as long as they are not harmful to the client. Demonstrating respect and a non-judgmental attitude will help promote a trusting nurse-client relationship. In option 2, arranging respite care for the daughter is premature at this time. This may eventually become necessary. Option 3 is an inappropriate intervention by the nurse. Only the daughter can come to the conclusion that it is her responsibility to care for her mother. Option 4. This is not the priority. This intervention may be done after a discussion with the client, daughter, and husband.
To reduce the risk of hypoglycemia in a full-term newborn weighing 2,900 grams, what should the nurse do? 1. Maintain the infant's temperature above 97.7 degrees Fahrenheit / 36.5 degrees Celsius. 2. Feed the infant glucose water every 3 hours until breastfeeding well. 3. Assess blood glucose levels every 3 hours for the first 12 hours. 4. Encourage the mother to breastfeed every 4 hours. The correct answer is 1. Maintain the infant's temperature above 97.7 degrees Fahrenheit / 36.5 degrees Celsius. Hypothermia in the neonate is defined as a temperature below 97.7 degrees Fahrenheit. Cold stress syndrome may develop if the baby's temperature is below that level. A healthy neonate does not need supplemental feedings, and if supplements are needed, they should be either formula or breast milk. There is no indication in the STEM that glucose assessments are needed for this baby. Babies should be breastfed every 2 to 3 hours. Feedings every 4 hours are not frequent enough. It is important for the student to know that a baby weighing 2,900 grams is an average-sized baby. They range 2,500 to 4,000 grams. In addition, because no other information is included in the STEM, you must assume that the baby is healthy. The answers, therefore, should be evaluated in terms of the healthy newborn. Hypoglycemia can result when a baby develops cold stress syndrome because babies must metabolize food to create heat. When they use up their food stores, they become hypoglycemic. The client who has been using oxymetazoline nasal spray for several weeks reports to the nurse that the spray no longer seems to work to clear the nasal passages. Which information should the nurse teach? 1. Increase the amount of sprays used until the desired effect has been reached. 2. This type of medication can cause rebound congestion if used too long. 3. Alternate the oxymetazoline with a saline nasal spray every 2 hours. 4. Place the oxymetazoline nasal spray in a vaporizer at night for the best results. The correct answer is 2. This type of medication can cause rebound congestion if used too long. Oxymetazoline is a nasal decongestant. Oxymetazoline is recommended for short-term relief of nasal congestion for clients older than the age of 6. This medication is for short-term use only. Longer use can cause a rebound congestion that can be difficult to resolve. Oxymetazoline should be used every 10 to 12 hours only. Using it more often increases the chance of developing a dependence on the medication and rebound congestion. Oxymetazoline nasal spray is to be used intranasally. It is not an additive for a vaporizer. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A nurse is doing a newborn assessment on a new admission to the nursery. Which of the following actions should the nurse make when evaluating the baby for developmental dysplasia of the hip? Select all that apply. 1. Grasp the baby's legs with the thumbs on the inner thighs and forefingers on the outer thighs. 2. Gently adduct and abduct the baby's thighs. 3. Palpate the trochanter during hip rotation. 4. Place the baby in a fetal position. 5. Compare the lengths of the baby's legs. The correct answers are 1. Grasp the baby's legs with the thumbs on the inner thighs and forefingers on the outer thighs. 2. Gently adduct and abduct the baby's thighs. 3. Palpate the trochanter during hip rotation. And 5. Compare the lengths of the baby's legs. With the baby placed flat on its back, the practitioner grasps the baby's thighs using his or her thumbs and index fingers. When assessing for Ortolani sign, the baby's thighs are abducted. When performing the Barlow test, the baby's thighs are adducted. With the baby's hips and knees at 90-degree angles, the hips are abducted. With developmental dysplasia of the hip, the trochanter dislocates from the acetabulum. The nurse would feel the dislocation while palpating the trochanter. Legs are extended to assess for equal leg lengths and for equal thigh and gluteal folds. When performing both the Ortolani and Barlow tests, the baby is placed flat on his or her back. When assessing for symmetry of leg lengths and tissue folds, the baby is placed in both the supine and prone positions. The order of the steps of the Ortolani procedure is 1. The nurse places the baby on the baby's back. 2. The nurse grasps the baby's thighs with a thumb on the inner aspect and forefingers over the trochanter. 3. With the knees flexed at 90-degree angles, the hips are abducted. And 4. The nurse palpates the trochanter to assess for hip laxity. The Barlow test is performed by 1. Adducting the baby's legs, 2. Gently pushing the legs posteriorly, and 3. Feeling to note any slippage of the trochanter out of the acetabulum. Galeazzi sign, to assess for uneven knee heights, can also be performed.
The nurse is teaching a client with hypertension about taking atenolol. The nurse should instruct the client to 1. Avoid sudden discontinuation of the drug. 2. Monitor the blood pressure annually. 3. Follow a 2-gram sodium diet. 4. Discontinue the medication if severe headaches develop. The correct answer is 1. Atenolol is a beta-adrenergic antagonist indicated for management of hypertension. Sudden discontinuation of this drug is dangerous because it may exacerbate symptoms. The medication should not be discontinued without a physician's prescription. Blood pressure needs to be monitored more frequently than annually in a client who is newly diagnosed and treated for hypertension. Clients are not usually placed on a 2-gram sodium diet for hypertension.
The nurse in a medical unit has received the morning report. Which medication should the nurse administer first? 1. Pantoprazole to a client on call to surgery. 2. Calcium carbonate to a client reporting indigestion. 3. Bismuth to a client diagnosed with an ulcer. 4. Famotidine to a client diagnosed with gastroesophageal reflux disease. The correct answer is 1. Pantoprazole to a client on call to surgery. Pantoprazole is a proton pump inhibitor. A medication for a client on call to surgery is a priority. The client's surgery could be delayed if the medication has not been administered when the call to surgery comes. Calcium carbonate is an antacid. This would be the second medication to administer, as this client has a report of discomfort. Bismuth is an antimicrobial. This medication is a routine medication and could be administered at any time. Famotidine is an H2 blocker. This medication is a routine medication and could be administered at any time. The nurse is caring for a 2-year-old child who was admitted to the pediatric unit for moderate dehydration due to vomiting and diarrhea. The child is restless with periods of irritability. The child is afebrile with a heart rate of 148 and a blood pressure of 90/42. Baseline laboratory tests reveal the following: sodium 152, chloride 119, and glucose 115. The parents state that the child has not urinated in 12 hours. After establishing a saline lock, the nurse reviews the physician's orders. Which order should the nurse question? 1. Administer a saline bolus of 10 milliliters per kilogram, which may be repeated if the child does not urinate. 2. Recheck serum electrolytes in 12 hours. 3. After the saline bolus, begin maintenance fluids of D5 normal saline with 10 milliequivalents potassium chloride per liter. 4. Give clear liquid diet as tolerated. The correct answer is 3. After the saline bolus, begin maintenance fluids of D5 normal saline with 10 milliequivalents potassium chloride per liter. Potassium is contraindicated because the child has not yet urinated. Potassium is not added to the maintenance fluid until kidney function has been verified. The child with dehydration secondary to vomiting and diarrhea is placed on a clear liquid diet. Fluid boluses of normal saline are administered according to the child's body weight. It is not unusual to have to repeat the bolus multiple times in order to see an improvement in the child's condition. It is important to monitor serum electrolytes frequently in the dehydrated child.
A hospitalized client who is being treated for hypertension with furosemide, atenolol, and ramipril, develops a second-degree heart block Mobitz type 1. Which of the following actions should the nurse take? 1. Administer a 250 milliliters fluid bolus. 2. Withhold the atenolol. 3. Prepare for cardioversion. 4. Set up for an arterial line. The correct answer is 2. The client may be asymptomatic, and the underlying cause should be assessed. Drugs that block the AV node should be avoided, such as beta blockers, calcium channel blockers, digoxin, and amiodarone. Symptomatic clients are treated with atropine and transcutaneous pacing. There is no indication for a fluid bolus, cardioversion, or arterial line.
Which instructions for a child diagnosed with encopresis should the nurse question? Select all that apply. 1. Limit the intake of milk. 2. Offer a diet high in protein. 3. Obtain a complete dietary log. 4. Follow up with a child psychologist. 5. After dinner, have the child sit on the toilet for 10 minutes. The correct answers are 2. Offer a diet high in protein, and 4. Follow up with a child psychologist. A diet high in protein will cause more constipation. The child and family would not be encouraged initially to seek counseling unless a psychological component to the encopresis had been identified. Dairy products are limited because they can lead to constipation. A complete dietary log should be kept to correlate the foods that lead to constipation. Children with constipation/encopresis are advised to sit on the toilet for 10 minutes after dinner to take advantage of the gastrocolic reflex.
A nurse is planning a teaching session for an older adult about a prescribed medication regimen, which is a major concern about older adults that the nurse should consider. 1. They experience an increase in absorption of drugs from the gastrointestinal tract. 2. They are less motivated to follow a prescribed drug regimen. 3. They are less likely to learn due to a decline in intelligence. 4. They have a decreased risk for adverse reactions to drugs. The correct answer is 2. They are less motivated to follow a prescribed drug regimen. Rationale. The literature documents that older adults are at high risk for non-adherence to a medication regimen because of its complexity. The larger the number of medications and the larger the number of doses per day, the higher the risk of non-adherence. One study indicated that the adherence rate was 87% for daily dosing, 81% for doses twice a day, 77% for doses 3 times a day, and 39% for doses 4 times a day. Other reasons for not fully adhering to a drug regimen include inconvenience, side effects, financial limitations, and/or perceived ineffectiveness of the drugs. A nurse determines that, according to Erickson, establishing relationships based on commitment mainly occurs in which stage of psychosocial development? 1. Middle-aged adulthood. 2. Young adulthood. 3. Adolescence. 4. Infancy. The correct answer is 2. Young adulthood. Rationale. Young adults, 18 to 25 years. Intimacy versus isolation. Strive to establish mature relationships, commit to suitable partners, and develop social and work roles acceptable to society. Unsuccessful resolution results in self-absorption, egocentricity, and emotional isolation. Middle-aged adults, 25 to 45 years. Generativity versus stagnation. Strive to fulfill life goals associated with family, career, and society, as well as to give to and care for others. Adolescents, 12 to 20 years. Identity versus role confusion. Strive to make the transition from childhood to adulthood with a sense of personal self. Infants, newborn to 18 months. Trust versus mistrust. Strive to have their needs met through interacting with others. When their needs are consistently met, they develop a sense of trust in their caregivers. A nurse identifies that a client in middle adulthood is experiencing a developmental crisis. Which of the person's behaviors supports this conclusion? Select all that apply. 1. Unable to mentor children in the next generation. 2. Difficulty in developing peer relationships. 3. Inability to achieve feelings of success. 4. Incapable of delaying satisfaction. 5. Failure to face eventual death. The correct answers are 1. Unable to mentor children in the next generation, and 3. Inability to achieve feelings of success. Rationale. A task associated with middle adulthood is sharing of self and performing activities that promote the growth of others, particularly those in the next generation. A major task of middle adulthood is successfully fulfilling lifelong goals that involve family, career, and society. If these goals are not achieved, a crisis often is precipitated. Developing peer relationships is one of the developmental tasks of the 6 to 12-year-old child and adolescent, not the middle-aged adult. Delaying satisfaction is one of the developmental tasks of the 18-month to 3-year-old child, not the middle-aged adult. Facing death is one of the developmental tasks of the 65-year-old and older adult, not the middle-aged adult.
The nurse is discussing oral glyburide with the client diagnosed with type 2 diabetes. Which information should the nurse discuss with the client? 1. Instruct the client to take the oral hypoglycemic medication with food. 2. Explain that hypoglycemia will not occur with oral medications. 3. Tell the client to notify the HCP if a headache, nervousness, or sweating occurs. 4. Recommend that the client check the ketones in the urine every morning. The correct answer is 1. Instruct the client to take the oral hypoglycemic medication with food. Glyburide is a sulfonylurea that stimulates the pancreatitis to secrete more insulin. The oral hypoglycemic medication should be administered with food to decrease gastric upset. The client receiving oral hypoglycemic medications can experience hypoglycemic reactions, as can clients receiving insulin. In option 3, these are signs or symptoms of hypoglycemia, and the client should be able to treat this without notifying the HCP. Ketones are a byproduct of the breakdown of fats, which usually does not occur in clients with type 2 diabetes because the client has enough insulin to prevent breakdown of fats, but not enough to keep the blood glucose level within an acceptable level. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.